Hi, I'd like to talk about myofunctional therapy for a minute. So what myofunctional therapy is very focused exercises for the tongue and the back of your throat to try to promote good tongue posture and nasal breathing. So we do know that with myofunctional therapy, if done consistently, it can not only improve snoring and breathing, but also reduce your apnea score. So there are actually some myofunctional therapists who are trained at providing specific treatment plans for you, and they can evaluate speech and tongue posture. And I have a whole list of providers that I'm happy to provide to you if you get really interested in this. But in the interim, there's a few things that you could do just at home that may help to kind of strengthen your tongue and promote nasal breathing. Proper rest is with your lips together, but your teeth a little bit apart and your tongue in the roof of your mouth. That's kind of where your jaw muscles are in their most rested state. And your tongue is kind of like the great on-off switch for your nose. So if your lips are a little apart and your tongue is down, you're gonna be tending to mouth breathe more than nose breathing. So if we need to focus on clearing out your nose, we can talk about saline or medicines or send you TNT. And something else that you can do simply is if you're feeling a little bit congested, you can just plug your nose, hold your nose for 5 to 10 seconds, nod your head like this. And then when you're done plugging your nose, you keep your mouth closed and continue to breathe through your nose. So it'll help to kind of flush out the nose just a little bit and promote nose breathing. So again, you just plug your nose, hold for 5 to 10 seconds, nod your head, and then breathe normally. Watch. So you'll notice my lips stay together, my teeth are apart, my jaw is rested, and after I'm done plugging my nose, I continue to breathe slowly through my nose. Now, some of the exercises that we can do that can be kind of myofunctional therapy based to, again, promote good nose breathing, good tongue posture, is we're aimed at strengthening the tongue muscles and the muscles at the back of your throat. They look a little bit silly, but you can incorporate them while you're driving or doing your routine so nobody has to watch you do it. I'll give you 4 or 5 and you can utilize them, with your routine. I would say for most people, we want to, aim to do the exercises 3 to 5 days a week and repeating them, each exercise, 5 to 10 times. So you're doing maybe a total of 10 or 15 minutes of exercises. So one exercise you can do is just stick your tongue out really far. So we're trying to kind of feel the back of your tongue muscles stretch. And if you want to do it against resistance, you could use a spoon and just stick your tongue against the spoon. And so you'll kind of feel the back of your muscles, stretching a little bit, and you're holding against the spoon or just sticking your tongue really far out to get that little bit of a stretch. Another one you can do is kind of a tongue suction hold. So you're gonna suction your tongue up into the roof of your mouth and hold it up there like this. So you'll be able to feel the floor of your mouth stretching a little bit. You can just suction up and hold, or you can suction up and then kind of drag your tongue up and back like that. That's another great way of, kind of strengthening the tongue. Another one is you can stick your tongue to the side of your cheek, either against resistance or just let your cheek be a muscle, to resist the tongue. You're kind of stretching both sides and going back and forth. So all of these, we're just trying to get your tongue moving around, stretching in your mouth. You can also, another exercise, you can kind of allow your tongue to drop down. So you're kind of letting your tongue drop down. And if you're looking at yourself in the mirror, the goal being to try to get the soft palate or the dangly uvula at the back of your throat to lift up. So you could say ah, or you're just kind of pushing the tongue down. Again, it almost feel like you're gagging a little bit, but you're gonna let the tongue drop down. Ah, and try to get the muscles at the back of your throat to lift up. That's another great exercise. Another one that you can do is aimed at trying to stretch your neck muscles. So you're kind of over exaggerating these lip and neck movements, but you can kind of go through some of the vowel sounds like E's and O's, where you stretch your neck, E, and you see I'm kind of stretching my neck muscles out. Ooh, and you're, kind of hyper exaggerating. You don't need to actually make the sounds, but the goal being kind of stretching and working these lower neck muscles. Another one is you could just get your finger in the side of your cheek and you're kind of suctioning against, we're trying to work on some of these cheek muscles. And we're kind of suctioning against your finger. And that can be another exercise you can do. So the aim with all of these exercises, again, is just to promote good nasal breathing. And they're all, you can be done in conjunction with the rest of your day. Sticking your tongue out, sticking your tongue against your cheeks, against resistance or not, suctioning your tongue to the roof of your mouth, trying to drop your tongue down and get the back of your throat to lift up, and then also kind of stretching some of these neck muscles. So feel free to add those in and see if you notice any difference in your breathing or sleep symptoms and snoring. And if you'd like to look into this further, I'd be happy to send you to one of our local myofunctional therapist experts who could talk through a more custom plan for you.